Hello everyone, a very good morning to all of you. So welcome back to RxDx. So today we're going to discuss about the general medicine topic, cardiovascular system. Okay. So before moving, I'll just brush up the cardiovascular system. I've already talked about this in physiology sections, so you can go and watch them. So we all know that the body tries to pump blood in via the superior and the inferior vena cava. Okay, and then it reaches the right atrium, which is separated by the tricuspid valve from the left atrium. And then we have the pulmonary veins receiving the blood on the other side. It reaches the left atrium, which is separated by the bicuspid valve from the left ventricle. So we have AV valves, tricuspid and bicuspid valves, and from the left atrium the blood enters into the pulmonary artery via the pulmonary valves, and from the left ventricle the blood enters into the aorta via aortic valves. These two are semilunar valves. Okay, so we have that is AV valves and the semilunar valves. So this is the very basics of the heart, how the heart pumps the blood. Now we see that there is a slight amount of increased muscles over the left ventricle. As I told you, it is mainly because of the pressure difference. So the left ventricle has to pump the blood to the entire body. It has to pump the blood via the aorta to the entire body, whereas the left atrium, it has to pump the blood to the pulmonary artery. It reaches the lungs. Okay, so more amount of muscle is present in the left ventricular side. Very important. This will be useful when I talk about the disorders. Okay, and that is mainly responsible for the increase in the pressure. So what happens, the muscle when they contract, more pressure or more squeezing is going to take place in the left ventricle, so that the blood is pumped into the aorta and it reaches the other parts of the body. It reaches the body. So this is what is happening. Okay, so now let us move into a few cardiovascular disorders. I'll tell you in a very simple way. Okay, ischemia is basically reduced blood supply, okay, to the cardiac muscle, which is nothing but the myocardium. So the muscles, they cannot function properly. There is going to be reduced contraction. So when there is reduced contraction, the blood is not going to get pumped adequately into the left ventricle and the aorta. So as I told you, there's going to be increased muscular activity on the left ventricular side. So any malfunction of the muscle, that's going to result in decreased contractility of the left ventricle. So the enough blood is not pumped into the aorta. Okay, so let us imagine that this is a coronary artery. Okay, so let us imagine that this is a coronary artery. Now what happens is, in some situations, the endothelial cell is going to get damaged. What is an endothelial cell? It is a lining of the blood vessel. We have three layers: tunica adventitia, tunica media, and tunica intima. So endothelium is present in tunica intima, the innermost layer. So in some situations like hypertension or diabetes, smoking, cholesterol, or in any case of chronic inflammation, the endothelial lining is going to get damaged. So let us imagine, I'll just give a small break in the epithelium. So this break in the endothelium, imagine that that is the damaged area. Okay, so the endothelium is getting damaged because of any of the situations which I have told, and there are also other causes of the endothelial cell damage. So what happens, any response or any damage to the body, the first defense will be inflammation. Obviously we all know the inflammatory cells migrate into that area and it tries to protect the body. So similarly, whenever there is an endothelial cell injury, the body is going to fight or try to repair the damage, right? So meanwhile, some other activities will also take place, right? So the first one will be, there will be migration of macrophages. Okay, the macrophages migrates into that area, and there will be migration of LDL from tunica intima. Okay, so the LDL migrates into the tunica intima, which is taken up by these macrophages which are already there, and these two become what is called as foam cells. These two become what is called as foam cells. And then what happens is the smooth muscle cells, they migrate into the damaged endothelium. So these smooth muscle cells are very important because they form fibrous cap. Okay, it forms like a cap over the whatever the foam cells has been created. And then what happens, it also releases the collagen. Okay, it also releases the collagen, which results in the formation of fibrous tissue. Okay, so imagine this is the endothelial cell, and then there is a formation of what is called as the atherosclerotic plaque. So what is atherosclerotic plaque is made up of? It is made up of dead foam cells, it is made up of fibrous tissue, it is made up of macrophages and inflammatory cells. Okay, so the atherosclerotic plaque is formed, and that atherosclerotic plaque, what it does is it basically interrupts the flow of the blood. So imagine a pipe. Okay, so if I'm putting some kind of a clay inside a pipe, there'll be definitely, or stone inside a pipe, definitely there'll be obstruction of the water flowing inside the pipe. Similarly, because of this atherosclerotic plaque, what happens, the blood flow is going to get interrupted. That is what we are calling it as ischemia. If it is mild obstruction, or if it is 75% obstruction, or it is complete occlusion, so that we are going to classify. Very simple, right? So ischemia, decreased blood supply to the muscle of the heart. What supplies the muscles of the heart? The coronary arteries. So coronary arteries gets blocked partially or completely by atherosclerotic plaque. What is atherosclerotic plaque? The foam cells, fibrous tissue, plus the inflammatory cells. We all know how it is formed now. And what causes this atherosclerotic plaque? Hypertension, diabetes, smoking, or any kind of chronic inflammation or cholesterol. So this is the causes of the formation of atherosclerotic plaque. Now moving on, I'm going to classify these ischemic disorders into two. One is angina and another one is cardiac failure. Okay, there can be angina and cardiac failure. So angina, if you see, there are two types of angina: stable angina, unstable angina. Okay, and cardiac failure, if you see, it can be non-ST segment elevated myocardial infarction or ST segment elevated myocardial infarction. Okay, non-ST segment elevated myocardial infarction or ST segment elevated myocardial infarction, NSTEMI. Okay, so we are going to deal with this in a very simple way. I'll tell you a very key findings and what do you see in these conditions. Okay, now, so imagine a patient comes to you with a stable angina. So stable angina, if you see, the patient will exhibit or will have pain only when he or she undergoes exertion or under stress. Okay, so stable angina is seen only in stress or exertion. Okay, so stable angina lasts less than 10 minutes. Okay, stable angina results in partial occlusion, or in simple terms, there is fixed narrowing of the coronary arteries. What do you mean by fixed narrowing? That is, there is no rupture of the atherosclerotic plaque. It's fixed and it's partial. Okay, so there's going to be fixed narrowing of vessel wall. So these patients, when they take the rest, it gets relieved. So relieved by rest. Okay, so what is the very important? See, as far as the general medicine is concerned, you should know well equipped in treatment plan. Okay, diagnosis and treatment plan is very important. So stable angina, if you see, there's going to be normal ECG. ECG will look normal, and there's going to be normal troponin values, troponin high and T. Okay, so what is the normal value of a troponin I? It will be around 0.04 nanograms per milliliter, and troponin T will be 0.02 nanograms per milliliter. You should definitely get used to these values. Okay, so in a stable angina, all these will be normal. Then how to find? So what happens in a treadmill test? Okay, treadmill test, there will be ST depression. Okay, in a treadmill test there will be ST depression. Okay, stable angina, the patient will have pain only in exertion or pressure. It lasts less than 10 minutes. There will be fixed narrowing of the vessel walls and the ECG troponin values will be normal. In a treadmill test, if I ask the patient to walk, there will be ST depression. This is about stable angina. Okay, now coming to unstable angina. So unstable angina, as the name indicates, there is rupture of the atherosclerotic plaque. So imagine now we are going to tell me that if this atherosclerotic plaque ruptures, what is going to happen is the fibrous cap which is covering the atherosclerotic plaque, it breaks. So once it breaks, what is the body going to do? It detects it as a form of an injury, right? So any break in the body is going to detect in the form of injury. So what happens when there is injury? Inflammation is triggered. So once this wall of the atherosclerotic plaque, which is nothing but the fibrous cap, gets obstructed or ruptured, the body detects it in the form of injury. It is going to send platelets there. So there is going to be formation of thrombus. Okay, so ruptured atherosclerotic plaque results in the formation of thrombus. So here there will be, in unstable angina, there will be rupture of the atherosclerotic plaque, and that is going to result in formation of partial thrombus. What do you mean by partial thrombus? That is the blood clot which is formed over the atherosclerotic plaque as it is rupturing is not causing complete obstruction of the vessel wall. It is just causing the partial obstruction. So that is called unstable angina. So these patients, they will have pain even at rest. So these patients will have pain even at rest. Okay, and these patients, it will be, the pain will last around 10 to 20 minutes. Okay, so these patients, if they take rest, it will not subside. It will last at least for 10 to 20 minutes. Okay, and similarly for these patients, the troponin values will be normal and there will be ST depression. ST depression will be seen. Okay, this is about unstable angina. So in a stable angina, what I'll do, I'll give sublingual nitroglycerin. Okay, in unstable angina, I'll look into the cause and I will treat it accordingly. Okay, so what I will do, I'll give antiplatelets, clopidogrel. Okay, so I'll give antiplatelets, anticoagulants, painkillers, statins. This will be for unstable angina as well as non-ST segment elevated myocardial infarction. So I'll give antiplatelets like clopidogrel. I'll give anticoagulants like heparin. I'll give painkillers like morphine and statins for the cholesterol. Okay, so this is about unstable angina. Now coming to non-ST segment elevated myocardial infarction. Okay, non-ST segment elevated means, see here, usually till now we see only ST depression, be it stable angina in treadmill test or normally in unstable angina you will see ST depression. In myocardial infarction or cardiac failure, there will be ST elevation. So that is why they call it as non-ST segment elevated myocardial infarction. So obviously, as the name suggests, there's going to be ST depression. Okay, these patients will have pain up to 20 to 30 minutes. There will be radiating pain to the left hand, and here what happens is there will be rupture of the atherosclerotic plaque, thrombus formation, but only key feature about distinguishing this with unstable angina is there will be more amount of occlusion compared to the unstable angina. So say for example, if the unstable angina, there is going to be rupture of the atherosclerotic plaque and formation of thrombus for 50%. Here it will be 75%. More percentage will be blocked by the atherosclerotic, more amount of plaque is formed by the thrombus. So because of the more amount of block which is formed by the thrombus, there's going to be more amount of occlusion and reduced output of the blood. So when there is reduced output, reduced ATP, so the muscle will not function. So the non-ST segment elevated myocardial infarction will have ST depression 20 to 30 minutes, and the troponin values will be elevated, and CKMB enzymes, the normal value will be around less than 5 nanograms per ml, it will be elevated. Okay, so non-ST segment elevated myocardial infarction, similar to unstable angina, but it causes more occlusion and lasts more than 20 to 30 minutes, and troponin values will be elevated, ST depression will be seen. In STEMI, there will be a complete occlusion. It is a life-threatening disease, needs immediate attention. So the treatment for the unstable and the non-ST segment elevated myocardial infarction will be almost the same. STEMI, definitely you need to have an immediate surgery, remove the block, and then proceed with the anticoagulants and antiplatelet drugs and painkillers and statins. Okay, so there will be complete occlusion of the coronary arteries. So what happens in STEMI? There will be a definite elevation of ST. As the name implies, ST elevated myocardial infarction. So it's going to be definitely, there's going to be elevation in ST waves. Okay, so these patients will have pain more than 30 minutes. Okay, ST segment elevated more than 30 minutes, troponin values elevated, CKMB values are elevated. Okay, so these patients will be complete occlusion of the coronary arteries. So this is about the ischemic heart disorders. So the ischemic heart disorders basically are two: stable, unstable angina, and non-ST segment elevated myocardial infarction, ST segment elevated myocardial infarctions. So non-ST segment elevated and unstable angina will be almost similar, but the only thing is in non-ST segment elevated there will be more occlusion. Obviously there will be ST depressions, and also here there's going to be troponin values and CKMB values is going to be elevated. In a stable angina, there's going to be depressed ST wave, that too in treadmill test. Okay, so the one that needs emergency or immediate attention is the ST segment elevated myocardial infarction. Okay, this is about ischemia, the first cardiac disorder. So the next one will be, so the next disorder what we are going to see is the heart failure. So what happens in heart failure is basically the heart cannot pump adequate blood into the body, or the heart cannot receive, or after receiving the heart again cannot pump the blood into the body. So basically it is a failure of pumping. Okay, so what happens, there is going to be blood received from the right atrium, it passes to the right ventricle, it passes to pulmonary artery, where it is taken back to the lungs. So the left atrium, it receives the blood from the pulmonary vein, and it is passed to the left ventricle, where it is passed to aorta, and it is distributed throughout the body. This is the basic mechanism what is happening. Okay, so imagine a patient comes to you with a heart failure. Okay, so what are the first things you will notice is there are two types of heart failure. Okay, so the one can be the right ventricular failure or the left ventricular failure. Left ventricular failure, right ventricular failure. So what happens is normally the left ventricular failure, if you see, imagine a patient comes to you with ischemic heart disease. What is ischemic heart disease? Ischemic heart disease is insufficient oxygen supply to a muscle. Because of the insufficient oxygen supply to a muscle, there is going to be decreased contraction of a muscle, because of which the left ventricle is not pumping adequate blood into the aorta. That is what is ischemic heart disease. So if a patient comes to you with the ischemic heart disease, what happens? The left ventricle is not functioning properly. So the blood is not adequately entering into the aorta. So what happens? There is going to be backflow of the blood. So backflow of the blood into the left atrium, that is going to result in backflow of the blood into the pulmonary veins. That is going to result in increased fluid accumulation in the lungs. Pulmonary edema. Okay, so this is a cycle. So left ventricular failure, because of most common cause will be ischemic heart disease, results in backflow of the blood into the left atrium, into the pulmonary veins, into the lungs. So in left ventricular failure, most commonly you see respiratory symptoms or signs. Okay, so what sign you will see in respiratory is dyspnea. Patient will have difficulty in breathing. Orthopnea. What is orthopnea? So what happens if the patient, tries to stand? There is going to be increased venous return. There is going to be difficulty in breathing. Paroxysmal nocturnal dyspnea. Night time. If the patient tries to so what you will see is dyspnea. Difficulty in breathing, obviously, because of the accumulation of fluid in the lungs, dyspnea. Orthopnea. Patient lies. When the patient lies, there's going to be increased venous return from the legs to the heart. Increased venous return, again it is backflowed into the lungs, difficulty in breathing. Paroxysmal nocturnal dyspnea. While sleeping, there will be decreased sympathetic activity. Decreased sympathetic activity, that is going to result in difficulty in breathing. So any kind of a respiratory problem will be predominantly because of the left ventricular failure, backflow of the blood into the lungs. Okay, dyspnea, orthopnea, paroxysmal nocturnal dyspnea, asthma, whatever it may be. Okay, so these are all the basics of left ventricular failure. Now imagine a right ventricular failure. Right ventricular failure is the main cause of right ventricular failure is the left ventricular failure. What happens is, see, there's increased amount of fluid in the lungs. Okay, so what happens, there's going to be increased pressure of the pulmonary arteries. There's going to be increased pressure in the pulmonary arteries. So what is going to happen is basically there is going to be increased pressure in the right ventricle. So there's going to be again backflow of the blood into the right atrium, and it enters the superior and inferior vena cava. So the superior and inferior vena cava is going to receive more and more amount of blood because of the right ventricular failure, which is due to the left ventricular failure. So what happens, the body is going to have more and more amount of fluid. So I can feel the jugular venous pulse because there is no valve between the right atrium and the superior vena cava and the inferior vena cava. I can feel the jugular venous pulse in the sternocleidomastoid muscle. I will have pedal edema. Okay, so because of the right ventricular failure, what are the things we are going to have? We are going to have pedal edema, ascites, increased jugular venous pulse. Patient will have increased weight gain. So these are all the things which you will have in case of right ventricular failure. So the most common cause of right ventricular failure will be, it is because of the left ventricular failure. Left ventricular failure is mainly because of the ischemic heart disease, poor pumping of the blood, backflow of the blood into the left atrium, pulmonary veins to the lungs. Again, it causes pressure on the pulmonary artery, right ventricle, and right atrial pressure increases. So that results in right ventricular failure. So this is what is the basics, what is happening in heart failure. So what I'm going to do in left ventricular failure is definitely I'll give diuretics, loop diuretics, furosemide or spironolactone. Okay, and then what I'll do, I'll treat the other causes. In case of right ventricular failure, first I'll treat the cause, that is if it is because of the left ventricular failure, I should examine what can be done, and then I'll move on to the treatment of other causes of right ventricular failure. So this is what is happening in case of very basics of heart failure. So in the next video, I'll be talking about the other disorders. So this is part 1 of cardiovascular disorders. So in the evening session, we'll be discussing about a few MCQs which were asked from these topics, and we'll discuss and apply the concepts there. So thank you so much. Have a nice day.